I am going to invite the next speaker is Dr. Lomi, and he is doing a lots of work on ocular tumors. He is currently working in AIMS. So Dr. Lomi is going to present pediatric ocular tumor comprehensive management strategies.
Okay. Very good morning, Dr. Rishi. Thank you for having me in this important session and giving me this privilege to share on pediatric ocular tumors in front of my teachers here. So I have no financial interest to disclose in this presentation. Pediatric ocular tumors are rare, but have a potentially serious growth affecting children's eye. Hence, the early detection is crucial for preserving the vision and preventing the metastasis. Common types intraocular are the retinoblastoma, and then orbital is the rhabdomyosarcoma. Retinoblastoma in India, we have 1,500 cases per year, which contributes about 33% of all global burden. So we see from this that the burden in our country is much higher as compared with the Western populations, and clearly depicts that the presentation out in our country is also different from the Western populations, where we see more of locally advanced as compared with the Western population. And the reason being, we all know that this because of delay in referral or illiteracy, because of lack of awareness. So there is common clinical presentation. The most common is leukocoria. You can have the squint, you can have the red eye, hyphema, ophthalmos, or with the uveitis, like with the pseudohypopion, or phthisis bulbi, with the orbital cellulitis, functioning proptosis mass, and sometimes with a secondary after enucleations. And you can see with regional lymph node metastasis too. So what next? What we see all these patients, we have to have the suspicion in our mind of ruling out intraocular tumors. So chemotherapy has been our gold standard for treatment since 1990s. All credit to the Kingston for this invasion, and since the inception of this chemotherapy, there's a marked reduction in the percentage of the enucleations, coming down to now 5 to 7% currently. So the current treatment protocol is mostly based on the chemotherapy. And intravenous chemotherapy has started in 1990s with standard vincristine etoposide carboplatin with the different doses. Now the targeted chemotherapy is more highlighted, that which was started intravitreal chemotherapy by Kaneko and Suzuki from Japan groups. From started with that, we have the intraarterial chemotherapy from Kaneko, and which was popularized by Abrahamson in 2008, and we have got periocular chemotherapy and intracameral chemotherapy from Francis Munier. So we see that in these studies on 20 years follow-up, where we see the globe salvage rates have significantly increased from for group A, B, and C retinoblastoma is nearly around 90 to 95%, and from group D is around 70%, and from group E is around 30 to 40%. So here's a case scenario: 8 years old boy with bilateral retinoblastoma was given systemic chemotherapy, intravitreal chemotherapy, VEC regimen. After 4 cycles, you see the optic disc, you can see the optic disc, you can see the macula, and the globe is salvaged, and the child is saved. Another case of unilateral retinoblastoma with group C retinoblastoma, patient was a good candidate for intraarterial chemotherapy. So this patient was received intraarterial chemotherapy of melphalan and was showing a good response. Another case with recurrence after systemic chemotherapy, there's a recurrence vitreous cysts were there. So this patient was subjected for intravitreal melphalan 2 cycles, but we see the toxicity of melphalan, retinopathy is seen. Where we compare with topotecan. Topotecan seems to be much safer as compared to the melphalan. Another case with tumor was regressed, but the recurrence was seen with vitreous cysts, with the retinoblastoma cysts in the intracameral area. So in this case, we have considered for the intracameral melphalan, that is 7 micrograms, 0.1 ml. After 3 sessions, that all the retinoblastoma cyst in the intracameral was all vanished. Another case was referred to us with this recurrence tumors, retinoblastoma, following chemotherapy with laser photocoagulations. This child was subjected to plaque brachytherapy. So plaque brachytherapy is also a good option when tumor is less than, thickness is less than 6 millimeter with a larger basal diameter of less than 50 millimeter, with a unifocal lesions without any vitreous cysts or the subretinal cysts. Plaque brachytherapy is a good option. And another case where plaque brachytherapy was done in this showing a good response. So in general, the management of retinal blastoma depends upon whether it's unilateral or bilateral. For group A, B, C, usually intraarterial chemotherapy works very good, or you can use systemic chemotherapy. For group D and E, if it's unilateral, may consider for inoculation, or if for globe salvage, IVC and IC. And for bilateral cases, usually we consider for the intravenous chemotherapy. Here's case or orbital retinal blastoma, which was subjected to systemic chemotherapy, where there was reduction in the tumor mass and patient was subjected to inoculation and with artificial eye again. And however, we need to have adjuvant systemic chemotherapy complete 12 cycle and also 20 session of external beam radiotherapy is required. Prevent the prognosis for high-risk metastasis. There's one study from our center which shown that massive choroidal invasions and optic nerve involvement, if it is there together, then there's high risk of overall survival rate is much lesser as compared with this without the involvement of massive choroidal involvement and optic nerve involvement. Another important studies which we have done from our center is the immune checkpoint marker, which we have found that the PDL1 and CTL4, which if it is present in a tumor, they have reduced survival to 72%, 77%, and in patients with primary retinal blastoma and in chemo failure patients, 50%. So in PD1 and CTLA4 is a good indicator to show the prognostic factors. So sometimes this aqueous liquid biopsy is another important topic where we see that circulating tumor DNA decreases with response to chemotherapy. So in this another in aqueous cytology, we see there's this chromosome number 6p gain have shown the 3.8 times greater risk of inoculation if it is present as compared without this chromosome 6p gain. Another intergenomic heterogeneity in bilateral retinal blastoma which found that the tumor fraction was found to be reduced and it is correlated with the regression of tumor. If with intravitreal malform injection, the tumor regress, the tumor fraction also have reduced. So taking a sample from the aqueous, it will help us. And the other eye which we compare it where there is no response to the chemotherapy, the tumor fraction was still high to 98%. And then it was corroborated very well with the enucleation sample. Another patient with leukocoria, a 2-year-old female, presented without any complaint of any trauma, exposure to pest, or deviation of the eyes. There is an anterior location heterogeneous mass was seen involving ciliary body. Here in the UBM, you can see a very classical intratumoral cyst and lens. So it was suspected to a case of ciliary body medullopithelioma. And on MRI, you see there is no extra ocular spread was there. Patient was subjected to enucleation, and then our diagnosis clinically was same as on histopathology, which confirmed ciliary body medullopithelioma. Rhabdomyosarcoma is also a very common presentation of orbital tumor in children, where you can see a rapid growth of proptosis as compared to the retinal blastoma, and you can see various patterns on histopathology, embryonal, alveolar, pleomorphic, or botryoid type chemotherapy, or sometimes orbital exenteration is a treatment in case of rhabdomyosarcoma. So this is a picture showing rhabdomyosarcoma. And lastly, the leukemia is also second next to the rhabdomyosarcoma, where you can see unilateral soft tissues growth with proptosis there. So in conclusion, early detection and diagnosis is a key for treatment of orbital tumors in children, where we usually have the collaboration of multi-specialty team is very important. More than 7 vision, we have achieved ultimate goals of saving lives and the eye. The evidence-based approach is very important, and the most important is the tender love and care for the patients and for the caregiver. Thank you all for your kind attention.
Thank you, Dr. Lomi, for your excellent presentation. Because these are the children, you see the magnitude that how much orbital there is a proptosis. They present very, very late. But those who present early, I think there we are successful.
Definitely.
And
Sir.
majority of them.
Yes, yes.
Thank you